whenever you're ready.
My name is Yasser Al-Sayed. I'm a professor of obstetrics and gynecology at Stanford University, and my specialty is high-risk obstetrics. I have had the distinct honor of being involved with Hospital de la Familia over the last several years, and I've made several trips to Juarez. I was asked about comment on what my impression of the hospital and what I saw there. And I was truly impressed. I think this is a very high quality hospital. High quality not only from the infrastructure and what had been built physically in terms of hospital rooms and equipment, but also really in terms of the commitment of the people involved, from the administrators to the physicians to the nurses. This was really a group of people who were striving to provide excellent quality care, struggling in many ways to fight the limited resources that they had available, but really their vision was one of excellence. And I saw that in the way they interacted with patients. I saw that in the way they tried to deliver cost-effective care, to provide the spectrum of specialty services, things that actually hospitals in the United States might not even have. Gynecologic oncology specialty, neonatology. These things were physically there, available in the hospital at a very impressive level. Everything was thought of, everything was considered. There were CT scans available, ultrasound machines, a functioning laboratory, and clearly a lot of thought had been given to the proper procurement of these equipment and to their maintenance and appropriate use. And so I was really impressed, again, not just by the physical structure, but by the individuals that occupied that physical structure. I think it's very important for the relationship to continue between Stanford and Hospital de la Familia. The world is getting smaller, and we need to maintain the bonds that tie us together as human beings, and one of those fundamental bonds is healthcare. And so the ability to share our experiences, to share information, not just in a unidirectional way. We've had faculty from the hospital come up to Stanford and work with us here and see how we do things. So it's really a give and take, and I think that it is crucial for both nations, both societies, both peoples to continue with this interaction. I think it's a very fertile one, and I think it's a very positive one. If I think of what impresses me most, beyond the services provided, beyond the resident education, what impresses me most about Hospital de la Familia is, again, the vision that created it and the commitment that maintains it. This is a huge commitment of time and effort and energy to serve the underserved in a respectful way, in a hospital that is well maintained and provides outstanding services. And that passion and caring for other people, I think, is really the thing that impresses me most over the last several years. So the question has arisen as to how did the Stanford relationship develop, and it was really quite fortuitous. It was through our former chairman, Mary Lake Poland, and Ms. Guadalupe de la Vega, who, from what I understand, met and talked, and a arrangement came to have some Stanford faculty come down and give a series of lectures. And so this, I can't really remember how many years ago this started, somewhere between 7 to 10 years ago. And we would go down and give a series of lectures to the local medical community. When we gave our first lecture. I remember it was a very small group, maybe 30 people, but in a very nice hall with a simultaneous translation and a lot of interest. And then over the years, it was really nice to see the number increase. I think we went from 30 to 70 to 100. And in the last time we were there a couple years back, there were something like 300 people in the audience, medical students, nursing students, medical physicians, community leaders, again in a beautiful hall, simultaneous translation, and really a very high quality symposium from my perspective. One of the I think really tremendous things that has come out of this interaction has been a Stanford OBGYN resident rotation in Juarez at the hospital. It's been a very popular rotation. We've had several residents go down to Juarez for I think it's about a 2-week rotation with a lot of great surgical experience and education and teaching. And so medically, it's a real benefit to our residents to work with the talented doctors in Juarez. But I think also on an emotional growth level for our residents, it's so important for them to see how other places in the world, not far at all from their own doorstep, function and do things. If their entire life is the Bay Area and Stanford, I think it's a very constricted, very narrow, very entitled view of the world. And I think this ability to go to Juarez and work with the excellent team there has been a tremendous positive in our resident experience.